All right. So this time we will be, give me one sec. We will be talking chapter 33. It's still under module 12. It's the second chapter of module 12. So this is just actually a review of what we have discussed from different body systems that we have from the previous module. I think it's in the early modules, and then we have discussed those different types of body systems, right? So this time in chapter 33, it's all about common diseases and disorders. I don't want you to worry too much with regards to common diseases and disorders. It's because I know as a PSW, it is not your role to remember, to know their physiotherapy, physiology, or the the reason or the causes of why the disease came up, what's the reason why there's the disease and all that stuff, right? I don't want you to worry about that too much. I just want you to, we will just touch base with this one because it is part of our module for sure. But of course, at least to have familiarization or ideas, right? So, disease, again, as what we have mentioned and discussed before, it could be acute, it could be chronic, it could be progressive or life threatening, right? So when we say acute, it's the end. It could be chronic, wherein it's there for a long period of time to the client's body. Progressive, it's growing or it's like advancing. Okay, so that's what, of course, life threatening. So in terms of common disease and disorder, of course, our clients are not too well when they are in a long term care facilities. They always have existing illnesses, right? So as a worker, as a healthcare worker, we need to be very compassionate. We need to always focus on our clients. That would be client centered approach. And it's very important, right? That is very important. So when we talk about communicable diseases, it actually caused by microorganisms transmitted between people. Remember, we have the chain of infection that we have discussed before. I don't want to go back to that. If you want to like review of that, you can always go back to your modules. But I'm pretty much sure I've seen you a graph or a picture about the chain of infection, right? So there might be some transmission routes. It could be direct transmission, indirect transmission, airborne transmission, or even vector spread. Vector spread, usually those are like insects bites, like mosquitoes and all that. Airborne, that you get the bacteria or the microorganism can grow through air. Indirect, it could be not, it doesn't need to be in direct contact with the client that is infected. It could be passed through a different person or things, while direct is like usually coming from the direct person towards you, right? Also about cancer overview. When we talk about cancer, it is sometimes uncontrolled growth of abnormal cells like tumors. It could be benign or malignant. So benign, it's not cancerous. Malignant, is the cancerous one, right? So early detection for cancer, it's always improves the outcome. So it always there when there's an early detection of cancer. So as we have discussed before, the integumentary system, it's all about the system like the skin. So when we talk about integumentary disorder, this includes the skin cancer, dermatitis, eczema, psoriasis, skin integrity, and infection prevention are the priorities for this, right? So usually it's all like skin diseases, right? That is what integumentary system. So bed sores, it's part of the integumentary disorders. Skin rash, what else? Scratches, those are part of the integumentary disorders. So you need to make sure that your priority here is the skin integrity, that making the skin intact, and of course infection prevention, because if there's an open wound, as much as possible we want to prevent the infection coming in or the microorganism coming in into that open wound, right? So that's the purpose of taking care of like clients with skin disorders. While musculoskeletal disorders, this includes of course the fractures, osteoporosis, arthritis. So our main goal here as healthcare workers, of course, pain control, the mobility, like transfer the client from bed to wheelchair. Those are your priorities. Making sure like if they have like a basic range of motion exercises, you need to do that. The safety protocols for those clients who have musculoskeletal disorders. Also, we can apply the hot and cold compress here too in the musculoskeletal disorders. Okay? Next, the nervous system disorders. So when we talk about nervous system, it actually affects the person thinks and the physical functions too, like the cognition and also the physical. The most common one disorder for this is the Parkinson's disease, because remember the client has involuntary muscle movement and also affects the cognition. Like they tend to forget things, they can't remember things. Also with stroke and epilepsy. Stroke also have the physical functions affected and sometimes their cognition as well, right? So that's what a nervous system disorder. So again, for this one, make sure that you always follow what's in the care plan. Always, of course, they're careful with their diet, the way you communicate with them, the way you give instructions to them, especially if there is a cognition issue. Next, the endocrine disorders. So endocrine disorders, the most common one for this is diabetes. It's very common in the workplace. We have clients who are actually, majority of them are actually diabetic. So in terms of medication management, it's always the nurse responsibility to do that. I think the main goal that we have as a PSW is to make sure that their diet is actually low in sugar. Make sure that they are not eating high sugar diet, and also like if they have like exercises or going for a walk, that will be ideal for you to guide them and at least assist them. And what else? Yeah, so basically those things. And of course, if they have like open wound or they have bed sores, make sure you report immediately to your nurse what's the condition, and if there's any differences, and make sure to protect the leg part, because they are prone to skin to wounds, right? Or to, like, it might have a difficult time of healing when they get wounded on the lower extremities, right? So it's very important that you take care of them. Next, the cardiovascular disorders. So when we talk about the cardiovascular disorders, usually this is the leading cause of death. Includes hypertension, coronary artery disease. What else? Those what do you call this? Those hypertensions that is it's not managed. Those CAD, those coronary heart failures, those are some of the that's under the cardiovascular disorders, right? So it's always make sure that if you are taking care of those clients, regular monitoring of their blood pressure if you're allowed to do it, but if not, it's the nurse responsibility to do that. Making sure that the proper exercises don't stress them out, and eating the proper diet, right? So low fat, low sodium, and all that stuff. Next, okay, so if you have questions with regards to chapter 33, you can always go back to your Elsevier 2022 Common Diseases and Disorders on chapter 33. So I'll just give you some of the most commonly one that you can see in the long-term care facilities wherein you will do your placements. But we still have a lot, and might be something. So again, as what I've told you, I don't want you to worry too much with regards to I need to know the disease, I need to know how it should be cured or whatnot, anything like that. No, that's not your role. Okay, your role is always to assist them, to give them ADLs, and to making sure that they are safe. Okay, so that's it for chapter 33. I'll see you in the last chapter of module 12. Have a good day.